So, and yes, there we go. Kat, are you able to speak?
Yes, hello. Thank you so much, Ranjan, for inviting me. I'm very excited to do this deep dive on the mechanisms of skin aging, as well as the treatments that we have available to treat skin aging and the future perspectives.
Let's see. Are we just oh yeah, recording is working. Great, perfect.
So let me tell you a little bit more about myself. I think that Ranjan did a phenomenal job at introducing me. So let me tell you more about my background and what motivated me to go into this field of medicine. So after completing my foundation training at the Cambridge University Hospital, I started working in A&E. And that is where I fully realized the extent to which modern medicine is very focused on treating the extremes of disease rather than prevention. That is how my interest in anti-aging medicine started. And many courses and conferences later, I decided to pursue that as my full-time career in the private sector. I currently have a startup. It's called Clinica. It's a private clinic in Cambridge City Centre, and it focuses on skin aging. And this is the first branch, and I'm hopefully planning to open many more in the future. And I am also working on my own anti-aging skincare line. So in this lecture, I would like to offer my practical perspective on our current understanding of skin aging mechanisms, as well as the treatments that we currently have in clinical practice that we can use to slow down and even reverse signs of aging in some cases. I'm also going to talk about the future perspectives that we have in research and about the controversial treatments that I'm sure everyone has heard about, so botulinum toxin and dermal fillers. And at the end of the session, we will have a little bit of time for questions and answers. So starting from the very basics, what is skin? Our skin is a living, active organ that constantly changes and evolves throughout our lifetime. Skin also seems to be the most controversial organ. While nobody would call into question looking after your heart, lungs, or brain, looking after your skin can be often perceived as vain or superficial. I would like to change that narrative, and I would like to actually everyone to see skin for what it truly is, which is one of our vital organs that we cannot live without. And there is nothing wrong with wanting to look after your skin and using anti-aging treatments to make it healthier. Our skin is approximately the size of a large dinner table, so 2 square meters. And importantly, it is the only organ that we can fully and constantly see in its entire extent. All the other organs are internal or partially internal. That visibility adds significantly to the psychological aspect of how we see our skin. Others can actually use it to guess our age, and we can physically see it aging. There is also growing evidence that damage to the skin can drive the processes of systemic aging, such as inflammation and even cognitive decline. So what are the functions of our skin? The most important thing by far that our skin does is serving as a barrier and keeping the moisture in. So if we lost our skin, we would die of dehydration or infection. It also protects us from harmful UV rays that keep bombarding our skin and causing DNA mutations. It also has an important role in thermoregulation. It makes vitamin D, which is important for our bone and teeth health. It also has a social aspect to it, so physical touch and skin-to-skin contact being crucial for bonding in humans. On this slide, you can see the histological structure of the skin. Our skin has 3 layers, each with different types of cells that serve different purposes. The very top layer is the epidermis, and that is the only layer of skin that we can see, assuming that the skin is intact, which is why when we think of our skin, we usually think of the epidermis. It's made of stratified squamous epithelial tissue, and the way that epidermis is built is like a brick wall. It serves as a barrier to pathogens and allergens, We have the bricks, cells called keratinocytes, and then the cement in between them, which is made of different fats and proteins. This structure makes our skin waterproof, and it prevents water loss from our body. Now here, a very technical slide, so we can see the structure of the epidermis. The epidermis contains cells called melanocytes. They are the spider-shaped cells that create pigment in our skin. And perhaps counterintuitively, darker skin types do not have more melanocytes. Their melanocytes just have more appendages which make more melanin. That is our natural sunscreen. In the epidermis, we also have the star-shaped Langerhans cells. They are the immune system cells that, very much like white blood cells, migrate from the bone marrow into the epidermis. Once they've migrated there, they wrap their appendages around the skin cells and they serve an immune function, so they eat all the intruders. The cells in our epidermis are constantly dying and being replaced. All of the regeneration happens in the deep layers of the epidermis, known as the basal layer. We shed millions of cells every single day, and the house dust is largely made of dead skin cells. Our epidermis is completely replaced every 4 to 6 weeks. That is why when people get tattoos, the tattoo has to be placed deeper than the epidermis. Otherwise, it would disappear very quickly. Since our epidermis doesn't have any blood vessels, it takes all the oxygenation from the layer below it, the dermis. The dermis contains a lot of collagen and elastin fibers, so the skin's scaffold. It also contains the blood vessels, the capillaries, and the sweat glands and oil glands. Underneath, we have the hypodermis, so the fat layer. This will be relevant later when we talk about dermal fillers. This provides insulation, shock absorption, and energy storage. As we age, we lose some of those fat cells, and this is where the volume loss in the face largely comes from. Here on this slide, we can see the histological changes that appear in the skin as we age. On the photograph, we can see 2 sections from mammary skin biopsies stained with HES. Section A was taken from a 19-year-old patient and section B from a 74-year-old patient. We can immediately observe that the epidermis is thinner on slide B, and there are less melanocytes and Langerhans cells in the epidermis. That is an important fact to remember because we will refer to it later when we talk about function and treatments. We can also observe flattening of the dermal-epidermal junction. So this section appears very flat, while this section is ridged and looks young and healthy. The dermal layer is also reduced in size, and we can see loss of elasticity and in further loss of blood vessels and important structures that reside in the dermis as well. So how do these changes that we saw under the microscope relate to the changes in our skin function as we age? Thinning of the epidermis, which is the brick wall that shields us from environmental factors, results in this kind of appearance of the skin. So the pathogens, allergens, and irritants find it much easier to enter the body through a paper-thin skin. We can also see some dryness, patches of inflammation. We know that there is an altered immune response in aged skin, and that is related to the loss of Langerhans cells in the epidermis. They are immune system cells that eat the pathogens. And this further contributes to the risk of infection. Because the dermis is thinner in aged skin, we also sweat less and we have reduced sebum production as we age. Because the blood vessels fail, we also have delayed wound healing. So what is skin aging? Skin aging is a complex biological process which is influenced by both genetic and environmental factors. When we think about skin aging, we usually consider the intrinsic factors, so what goes on inside the organ, and the extrinsic outside factors. All of those factors combined affect how quickly our skin is aging. We're all familiar with what aged skin looks like, and we intuitively recognize the lines, wrinkles, and pigment changes in the skin. In a famous interview for her 121st birthday, Jean Clement, who is widely regarded to be the oldest person who ever lived, jokingly said, "I've only got one wrinkle and I'm sitting on it," proving that she still had good sense of humor. Jeanne, who died in 1997, was, as we can see, extremely wrinkly, and she may not have been as old as she claimed. She was probably around 97 years old when she died. So she was possibly the only woman who ever lied about her age to claim that she was older than she was. Now, if we live long enough, we'll all eventually get there to the very top of the Fitzpatrick wrinkle scale, unless we do something to prevent our skin aging. So let's have a closer look at the intrinsic aging factors that go on in the skin. So first of all, we've got the genetic and cellular processes. Our genes play a crucial role in determining how our skin ages. If your parents or grandparents maintained youthful skin well into later years, you might be in luck. However, genetic predisposition can also mean you're more susceptible to certain age-related skin conditions, like wrinkles and age spots. Then we have cellular senescence. So every cell in your skin has a life cycle. Over time, cells go through a process called senescence, where they stop dividing and enter a state of dormancy. The senescent cells accumulate and send inflammatory signals, which can damage surrounding cells and tissue, leading to wrinkles and loss of skin firmness in a phenomenon also known as inflammaging. Then we have the hormonal changes. So hormones, particularly estrogen in women, play a significant role in maintaining skin thickness and hydration. As you age, hormonal levels fluctuate, especially around menopause, leading to a rapid loss of collagen after the menopause in women. The structural changes are due to loss of collagen and elastin, which are the skin's scaffold. As we saw in the histological slide earlier, with age, the production of those proteins slows down. Collagen fibers begin to break down and elastin loses its elasticity, much like a worn-out rubber band. That results in sagging and formation of wrinkles. Internal processes also include telomere shortening. So think of telomeres like the plastic caps at the ends of shoelaces that protect your DNA. So every time a cell divides, the telomeres become shorter and shorter. When they become too short, the cell can no longer divide and function properly, contributing to the aging process. And lastly, we have the metabolic, immunological factors and glycation of proteins. So as we age, our metabolism slows down, affecting the skin's ability to repair and regenerate. Reduced metabolic activity means that skin cells don't renew as quickly, leading to a duller complexion and slower wound healing. Glycation is a process that occurs when sugars, particularly glucose, bind to proteins and lipids without the assistance of enzymes. That leads to formation of harmful molecules called advanced glycation end products, also known as AGEs. When AGEs form on collagen and elastin proteins, they become stiff, malformed, and less effective at supporting the skin structure. So imagine the scaffolding of a building that is gradually rusting over time. That is glycation. So let's focus for a moment on the genes that are involved in skin aging. These genes are the targets for existing and future anti-aging skin treatments. There are some genetic conditions that cause premature skin aging and can make a person look much older than their age. So on this picture, you can see a 26-year-old woman suffering from Ehlers-Danlos syndrome. It's a rare connective tissue disorder that affects the genes that code for collagen, which, as we can see, leads to a decrease in skin firmness and
I love
structure.
you. I love you.
I love you too. The collagen genes are COL1A1, COL1A2, COL5A1, and COL5A1. These are not all the collagen genes, but some of them that I have chosen to talk about. So COL1A1 is particularly relevant because there was a study that showed that tobacco smoke is associated with decreased expression of that gene. So we see how environment can affect the expressions of those genes. We don't know exactly what mechanism that is. Nevertheless, that was the association. And then we have retinoids, which are prescription products that we use in skincare, and they have been associated with increased COL1A1 and COL1A2 expression. Okay, and then we have the matrix metalloproteinases, called MMPs in most scientific studies. They are the collagen breakdown proteins. So they are the molecules that break down the extracellular matrix components, and they play a significant role in skin aging and other degenerative processes. Stopping MMPs from eating your collagen can help to maintain skin structure and integrity. So I like to think of MMPs as the agents in the matrix. They want to hunt down and terminate our main character, collagen, Neo. And some antioxidants have the power to stop them. They include vitamin C, vitamin E, and resveratrol. They can be found in numerous skincare products, dietary products. So these are our Trinity, Morpheus, and all the other good guys in the matrix. Both topical retinoids and red light therapy also inhibit MMPs through upregulating TIMP1. That is tissue inhibitor of metalloproteinases 1. It's a mouthful. TIMP1 does what it says on the tin. It's a natural inhibitor of matrix metalloproteinases. It stops them by binding to active MMPs and preventing them from degrading the extracellular matrix components. This is important for processes such as wound healing, formation of new blood vessels, and tissue repair. TIMP1 has also been shown to have some anti-apoptotic properties, which means that it stops cells from dying under various conditions. Then we have the elastin gene. So that is another key gene that is involved in skin aging. Elastin is a protein that gives tissue the ability to stretch and bounce back. So think about it like a rubber band that allows your skin to snap back in place after being pulled. In young skin, elastin fibers should be abundant, well organized, making the skin firm and elastic. This is why if you pull on young skin and let it go, it will bounce back quickly. However, if you pull on older skin, it usually will not bounce back so quickly. It will sag. In this picture, you can see a young man who is suffering from a rare genetic disorder called cutis laxa. Cutis laxa is another connective tissue disorder that affects the elastin gene. Mutations in that gene and other genes unfortunately lead to malformations in skin, heart, intestines, and other important organs in this genetic disorder. Then we have the telomerase reverse transcriptase gene, so TERT. TERT is very complex. It is part of our DNA, which instructs the cells to make the enzyme telomerase. I have already mentioned telomeres. There are the plastic ends at the ends of our shoelaces that help to maintain the length of our DNA as the cell divides. Telomerase can add DNA back to the end of the telomeres, keeping them long and healthy. So in theory, that should lead to an increased ability to regenerate. However, telomeres are very mysterious still. We don't know very much about them, and we don't really know that much about that gene yet. Another set of key genes involved in aging, sirtuins, which are the ancient family of proteins that play a key role in skin aging. I think of them as old-fashioned proteins because they are highly conserved throughout the animal kingdom. There are 7 types of sirtuins in mammals, and sirtuins help to repair damaged DNA in skin cells, prevent mutations, and maintain cell health. They also reduce inflammation, which can damage the skin and accelerate aging. Sirtuins also increase the cell's ability to resist stress, which helps with resistance to environmental factors such as UV rays and pollution. Some sirtuins also help to maintain collagen levels, keeping the skin firm and elastic. Then we have the antioxidant genes. So we have SOD1, SOD2, CAT, and GPX1. They play a crucial role in protecting skin cells from oxidative stress, which can contribute to aging. These genes produce enzymes that neutralize harmful molecules and prevent cell damage. Of course, with all of those genes, it's hard to be certain what exactly is the mechanism of their action and their influence on skin aging. Nothing in biology is simple. We have very complex systems. And even though sometimes something in biology makes perfect sense, it will not necessarily work that way. And I think that is something that's very hard as a concept to understand for people who come from, for example, physics or mathematics. So let's look at the extrinsic aging factors that affect our skin. So the external factors that affect skin aging include, first and foremost, photoaging. These are the changes caused by sun damage, so UVA and UVB radiation, that damages the DNA in our skin cells and accelerates the breakdown of collagen and elastin and causes oxidative stress. Then we have environmental pollutants. Air pollution, particularly in urban areas, exposes the skin to harmful particles and gases. These pollutants penetrate the skin barrier, causing inflammation, oxidative stress, and breakdown of collagen and elastin, which in turn leads to aging. Next, we have the lifestyle choices, such as smoking and poor diet. Smoking introduces a whole host of toxins into the body, and it really does accelerate skin aging. We do not know exactly through which mechanisms, but there have been theories about it affecting the collagen genes directly, and of course through free radicals. Chronic stress increases the production of cortisol, a hormone that can break down collagen. It also impairs the skin barrier, leading to dryness, inflammation, and a dull complexion. And one of the best ways to combat chronic stress is to exercise regularly. So if you want to have great skin, then make sure that you get in that regular exercise. So let's look at how much of skin aging is caused by genes and how much is caused by the environment. There was an interesting study published in the Journal of Plastic and Reconstructive Surgery, which actually looked at 186 sets of identical twins, so people who have exactly the same DNA, but had different environmental exposures. So on this picture, we can see 2 twins. They're both 61 years old. Twin A had approximately 10 hours of sun exposure per week less than twin B. So twin B had a lot more sun exposure. Let's look at how sun damaged and aged that skin is. Then we have a second set of twins, 52 years old. At this time, twin A was 7 times the amount exposed to sun rays and also smoked for 20 more years than twin B. The last set of twins, so this twin had a happy long marriage and this twin had a very difficult divorce. And we can see that twin B has much more facial lines that are deep set and has lost some facial volume as well. I'm sure that many of you will be familiar with this picture. So this is a very famous picture that was first published in a very prominent scientific journal called the New England Journal of Medicine. And it is a picture that shows you a truck driver who was exposed to a sun for 28 years just on one side through the window. He was, of course, not wearing any protective sunscreen. Another picture which is demonstrating the importance of wearing sunscreen. This is a 92-year-old patient. This was published in the European Academy of Dermatology in 2021 as part of a report of skin cancer and skin aging. And you can see that the cheek is very much youthful and the neck is very, very aged. So this patient was applying sunscreen religiously to her face every day, but she unfortunately forgot about the neck. So, as we can see, wearing sunscreen gives us an extra layer of protection in addition to our own melanin. There is a common myth that only UVB rays damage the skin, but actually now we know that both UVA and UVB rays are very damaging to our skin. So it is important to wear a broad spectrum sunscreen. In terms of what SPF we should be using, it's a very common question that I get. What SPF means, it's basically how much longer it would take for our skin to get red with the sunscreen on compared to without the sunscreen. So for example, if it would take 1 hour of direct sunlight on your skin to make your skin go red, in theory with SPF 30, it would take 30 hours. But that's just theory because these studies were based on very thick layer of sunscreen that was being applied. So in reality, with the amount of sunscreen that we apply daily under normal conditions, it's probably around half of the protection that we're getting. So if you're using SPF 50, you're probably getting more like 30. If you use 30, you're probably using 15 in practice. So it's very important to make sure that that SPF can be as high as possible. Another issue was with maintaining the sunscreen on the skin throughout the day. So unfortunately, we sweat, we wear makeup. So sunscreen that we apply in the morning is usually not there by the evening. We advise ideally to apply sunscreen every 2 hours. That might not be realistic with a cream, but now we have preparations with powders and sprays that are much more easy to reapply, so you can use them throughout the day and on the go. So let's have a quick look at the US sunscreen market. Interestingly, the US has not approved a new sunscreen ingredient since 1999. So just to get the idea of how ridiculous that is, in the 1999 year, we had Walkmans and our computers made a weird sound when they connected to the internet. We have so much better technologies now available to us in tech, but unfortunately not so much in the world of sunscreen. So in 2014, the Congress has even passed a special law that required the FDA to approve a new ingredient, but that has also failed, and South Korea has overtaken us in the process of approving new sunscreens. So these new sunscreens, which include Tinosolv S and Uvinol A+, are much more user-friendly and are also known to be better at being broad spectrum coverage. After UV radiation, the next big challenge to our skin is the environmental pollution. So this particularly concerns people living in big cities, which my guess is would be most people listening today. Air pollutants create an oxidative stress environment that damages the skin and impairs its function. So let's have a closer look at the specific pollutants. We have the particulate matter, which includes tiny particles from vehicle emissions, industrial processes, and construction. These particles can penetrate the skin, leading to oxidative stress and inflammation. The way to combat them is to use gentle cleansers to remove the particles from your skin after you've ended your day, and applying serums with antioxidants such as vitamin C, E, or niacinamide. Then we have ozone. Ozone actually depletes antioxidants in the skin, leading to increased oxidative stress, inflammation, and damage to skin barrier. This can cause dryness, fine lines, and loss of elasticity. Again, antioxidants are quite effective at dealing with that. We can use coenzyme Q10 and resveratrol, for example. Then the PHAs, so polycyclic aromatic hydrocarbons. There are products of fossil fuel combustion. They can bind to cell membranes and generate reactive oxygen species, causing cellular damage and aging. The way to fight them is with cleansers that are detoxifying. So, for example, contain activated charcoal. And finally, tobacco smoke, as we previously said, damages the collagen and elastin in our skin and leads to accelerated skin aging. The question I often get asked is, does blue, so HEV light, actually accelerate skin aging? And unfortunately, it does. Blue light can penetrate even deeper than UV rays, causing oxidative stress, accelerated aging, and inflammation. So I class it as a type of environmental pollutant because of the effect that it has. And of course, I would advise everyone to spend less time in front of their screens, so limit phone and computer time. However, if that's not realistic, the way to protect yourself is through using blue light blockers, either on your skin or on the screens. Another common question related to external factors is about shaving. So that usually comes from men, and men often ask me, how is actually this shaving relating to skin aging? Is it accelerating it? Is it good for your skin? Is it bad for your skin? Well, it can be both. So the positive effects would be the exfoliation. So as we use the razor, we exfoliate the dead skin cells, and that can lead to better penetration of skincare products. It can improve the blood flow because of the physical stimulation of the skin. But the negative effects can be skin irritation, razor burns, cuts, so disruption in skin barrier, sensitivity to products. So that increased penetration is actually a double-edged sword. So a product can penetrate deeper in the skin and cause irritation, or it can cause more beneficial effects. Then there is risk of post-inflammatory pigmentation. So that is from cuts. That is when patients injure themselves and the pigment stays in the place where the cut was long after it has healed. So my advice would be to use a good shaving technique. Make sure that you always use high quality products during shaving, and also use a moisturizer to replenish any breaks in skin barrier caused by that mechanical exfoliation. So here is a quick recap of how to protect your skin from environmental factors such as pollution. So double cleanse at the end of the day. That means use a wipe first, so it can be water-based or micellar fluid to wipe the pollutants off your face, and then actually wash your face with a cleanser, ideally a detoxifying one with charcoal if you live in a highly polluted area. In the morning, before you go out, you can apply an antioxidant serum if your skin can tolerate it, and then follow up with a broad spectrum sunscreen. I would advise to apply a good quality moisturizer at least once a day to replenish that cement in between your cells. So moving on to treatments that we have available in clinical practice. And that is probably my favorite treatment that can be used topically, so can be used at home, but by most patients, and it is retinoids. So if there was one skincare ingredient that I would make everyone use, it would be that. It's the closest we have in terms of a miracle skincare ingredient that is fantastic for anti-aging. It helps to reduce lines and wrinkles. It helps to improve skin texture. It treats acne, and it improves collagen production. So retinoids were actually originally invented as a treatment for acne, and then researchers realized that they have a very beneficial anti-aging effects. And these effects can be observed in biopsy skin samples. There have been thousands of studies of retinoids, and they are consistently found to be working very, very well in terms of skin anti-aging. So the most important thing with retinoids is to apply it regularly and apply a retinoid that is of a sufficient strength to get a good result. The prescription retinoids that we usually use in clinical practice are tretinoin and a more modern retinoid called adapalene, which tends to be better tolerated by sensitive skin types. Again, retinoids work by stimulating collagen production and accelerating cell turnover, which means that the skin cells from our epidermis will also shed faster. And that brings us to the side effects that they can have. So if the skin is shedding faster, it can also become a little bit dry and flaky. And that is the most commonly observed side effect. The most kind of easy to implement way to remedy this would be to make the patient use the retinoid less often or decrease the strength. The only groups of patients that cannot use them are pregnant patients or breastfeeding patients. So we know that isotretinoin, which is an oral version of retinol, which is used to treat severe acne, is very teratogenic, so it can cause birth defects. So patients who are on that treatment have to be on a very strict birth control. That is not true of the topical retinoids. There are much milder versions of vitamin A, but they do have some penetration into the bloodstream, so they can actually be found in breast milk, and they could potentially go through the placenta into the developing fetus. So we usually advise patients to err on the side of caution and not use retinoids when they are pregnant or breastfeeding. Then a very fashionable ingredient in skincare. So peptides. Peptides are anti-aging molecular messengers. So they actually have the ability to go through the skin and message to the cells to produce more collagen, for example. So we have matrixyl, which is a peptide that is known to stimulate collagen production. Then we have argireline, which is a muscle relaxant. So it works on a similar principle to botulinum toxin by reducing the depth of expression lines and reducing those imprinted lines in the skin. The copper peptides are supposedly having some anti-inflammatory effect, and they enhance the overall skin repair process. And then we have palmitoyl tripeptide, which supports collagen and elastin production, so it improves skin firmness and texture. So that all sounds amazing. So where's the catch? The catch is that it is incredibly difficult to formulate with peptides. Peptides are very fragile. They degrade very quickly. They are sensitive to light and air. So ensuring that the product is well formulated and it actually works takes a lot of money. These products are very, very expensive to make and therefore are quite expensive to the consumers as well. There are also products that only work when applied consistently over a long period of time. So they have the compound effect of anti-aging over a long period of time, but they do not have any short-term benefits, really. Then moving on to topical antioxidants. So topical antioxidants are brilliant anti-aging skin treatments. As previously discussed, they have multiple benefits, ranging from their potential effect on genes involved in skin aging to protecting us from the environmental pollutants. So imagine your skin is like an apple. If you leave it cut open, it will go brown due to oxidation. And vitamin C and other antioxidants are the lemon juice you put on the apple to keep it fresh for a long time. So a good topical vitamin C can brighten the skin, boost collagen, and neutralize free radicals and speed up the healing process as well. Vitamin E is also an excellent antioxidant and works synergistically with vitamin C. Then we have niacinamide, which in addition to its antioxidant effect, also supports the skin barrier. Green tea has some antioxidant effect because of the catechins and polyphenols that it contains. However, green tea as a topical cream is a little bit controversial. So while it's extremely popular, especially in Korean skincare at the moment, it actually has very limited evidence in human studies. There is more evidence on consuming green tea as a supplement, but there's also really limited evidence in terms of skin aging. There were trials where people were taking green tea extracts for years and there was absolutely no effect on skin aging. So if you like a green tea, by all means drink it. I've got one here, but it's unlikely to have any meaningful effect on your skin aging. Again, limitations of antioxidants are that they can be quite unstable. So my patients often ask me, which vitamin C to get? Can I just get anything off the shelf? And the truth is, most of those products that are available over the counter, unfortunately, do not work very well. So they can be already deactivated. Vitamin C is very light sensitive. So if, for example, you see a vitamin C serum in a transparent bottle, it's probably not working. Then moving on to systemic treatments, they offer some promising avenues. So oral antioxidants such as carotenoids and polyphenols should function, in principle, the same as the topical antioxidant. However, more research is needed because as we saw in the green tea extract studies where people were taking the extract regularly, and nevertheless, there was no effect on skin aging, it can be a little bit controversial. There is hormone replacement therapy, which some patients swear by and say their skin has really improved while they're taking it. But again, there is actually little evidence. It showed mixed results in trials with the effect on skin aging. Nutritional supplements that are widely recommended, and I'm sure everyone has heard about, are omega-3 and collagen. But not all omega-3 and collagen supplements work. So the collagen molecule is too large to actually penetrate the gut lining. We can't absorb it from the gut into our blood. So the only way to really make the collagen go into our bloodstream is through using hydrolyzed collagen, so collagen peptides. So if you're looking for a collagen supplement, just make sure it is in a hydrolyzed form. Then when it comes to omega-3 fatty acids, they have been shown to improve skin health, that's true, but only with supplements containing high doses of EPA and DHA. So the daily dose of EPA that was effective at reducing inflammation, redness, and photo damage in the skin was between 2 and 4 grams. That was 2 and 4 grams of EPA and DHA. And by comparison, an average fish oil contains maybe 180 milligrams of EPA and 120 milligrams of DHA per 1 gram of fish oil. So that is really not enough to have an effect on our skin. So overall, while there is some evidence supporting the efficacy of those treatments, there are some concerns about long-term safety, optimal dosing, and also the prevalence of false marketing claims. So we will need a more rigorous approach to test those systemic treatments and make sure that they actually work for skin aging. Moving on to my favorite professional treatments. So as a clinician, I use numerous procedural treatments in my clinic to work on skin aging. They include chemical peels, radiofrequency microneedling, red light therapy, and laser treatments. Chemical peels are usually strong acids, such as mandelic, glycolic, and lactic acid, and strong retinol. They can range from superficial to deep in strength. They remove the top layers of dead skin cells by speeding up exfoliation, increasing cellular turnover, and increasing collagen production. They can also work brilliantly for removing pigmentation. After chemical peels, we usually notice improved skin texture, reduced appearance of lines and wrinkles, and reduced pigmentation. effects can range from mild effects to dramatic, depending on what peel strength we are using. So remember, these peels range from very, very mild that people could potentially use at home to very strong prescription drugs that can only be applied by a doctor. They also have some anti-inflammatory effect, so they help with acne, and they are good all-round treatments for many, many skin concerns. Usually we need around a course of 5 or 6 treatments to see a significant improvement, and we recommend to do a chemical peel not more often than once a month. That is to prevent the disruption of skin barrier with the strong chemicals that are involved in this treatment. One of my favorite anti-aging treatments at the moment is radiofrequency microneedling. Radiofrequency microneedling combines 2 modalities. So it's microneedling using tiny little needles that penetrate the skin, and they create micro-injury. So they create a controlled state of inflammation that the skin can then use to regenerate. The radiofrequency that is added also heats up the skin, and it increases its tightness in the long term. It also shrinks the blood vessels during the procedure, so the downtime is not that bad for the patients. It's much less than with traditional microneedling. That method is also very much more controlled than the pen microneedling. So when we microneedle with a pen, we drag the skin surface and we create scratches, we create a lot of trauma and a lot of breakage of the skin barrier. So often the downtime after that is quite significant. The patient goes out with skin that's very red and inflamed and can stay so for days, which is not very nice, particularly for people who are professionally active or have a busy social life. They really don't want that downtime. With the RF microneedling, the redness is only for a few hours, maximum to 24 hours that I have observed in my experience. And that is due to the added effect that the radiofrequency has. Red light therapy, that is currently rising in popularity. I'm sure you've seen those lamps on social media, on the internet. They are incredibly, incredibly popular with celebrities. So does this treatment actually work, is the question that I get asked very often. Yes, it does. And it works on a very clever principle. So the principle of this treatment is photobiomodulation. It's a phenomenon where the light hits the skin and it acts on photoreceptors, and then causing a biological reaction in the skin. Usually the wavelength is between 630 to 850 nanometers. So quick revision from physics, you probably remember the light spectrum. The red light spectrum starts around 630, and this is the spectrum that we use in this treatment modality. There are some very strong studies that show that this treatment is genuinely working as an anti-aging treatment. So as we can see on this slide, in a placebo-controlled, double-blinded, split face trial, so they used the light on one side of the face and not the other. That was published in the Journal of Photochemistry and Photobiology. We saw that skin biopsies showed higher level of collagen, elastic fibers, and there was actually an increased amount of activity in fibroblasts. These are the cells that produce your collagen. And that correlated with clinical assessment. So when the doctors look at those patients, they actually had less lines and wrinkles. The proposed mechanism by which the red light worked is through the TIMP1, so the inhibitor of the matrix metalloproteinases that we talked about, the buddies and the matrix that eat our collagen and eat our extracellular matrix. So this is a brilliant treatment because it's very cheap to make LED light diodes that emit red light. These devices are portable, they are small, they are easy to use, there is no downtime at all, so no side effects, no redness. The patient can go home looking as they did when they entered the clinic. Now, with the devices that we actually have available to consumers on the market, there are several problems. So my biggest issue with them is the output. The clinical trial that we looked at, so the double-blinded randomized control trial that we saw, used a device that had an output of 105 milliwatts per centimeter squared. That is a very high output. These commercially sold devices rarely actually reach that level, and they do not present it consistently throughout the length of the treatment. So some of those devices don't even mention the output. It's impossible to find out what the output is. Some of them say it's up to, for example, 40 milliwatts per centimeter squared, which doesn't really sound reassuring because it means that at some point the device did reach that 40 or 45 milliwatts per centimeter squared, but that could have been a single spike. It was not necessarily a consistent output throughout the duration of the trial. With the small handheld devices, there is also an issue of coverage. So if a device only has, for example, 7 LED diodes, it's not really going to cover the whole area that we're trying to treat, and trying to hover with the device around your face, it's definitely not going to produce a consistent photobiomodulation throughout the whole skin area that is being treated. They perhaps are good for spot treatment, so they can be used as spot treatment for particular tiny little areas that you want to treat with red light, but they certainly will not be very good to cover a larger areas for an anti-aging effect. The treatment has to be repeated regularly, so the patient has to be willing to walk around looking like a cyborg a few times a week, which can be problematic to some people, but most people are very willing to try it, especially if they have severe signs of aging and they don't want to use more radical treatments that produce downtime, or if they have eczema, psoriasis, acne, inflammatory disorders. They see very, very good results from those devices, and we see them quite consistently in clinical practice. So here is another form of red light treatment that I use in my practice. These are lasers. So laser also use that spectrum of light, but they are much more concentrated and stronger in terms of how they work. They require big, bulky equipment, and unfortunately, they are very expensive. I have recently bought a laser from my clinic, and it cost me around £100,000, so I know how costly they can be. They are quite strong treatments at the extreme end of the spectrum. We can also use lighter ones, but they are not as effective. The main lasers that I use in my practice are Nd:YAG, so 1064 nanometers, and CO2 laser. So the Nd:YAG laser is great for milder treatments. The laser doesn't actually even touch the skin during the treatment, so we just hover with the laser over the patient's skin. And due to this phenomenon called photobiomodulation, it acts on the skin to reduce inflammation and to increase collagen production and reduce signs of aging. Now, the CO2 laser is the nuclear option. It is an ablative laser that completely takes away the top layer of the epidermis. So that laser is incredibly strong and powerful. It can be used in surgery to cut through tissues, and it can be used for strong skin resurfacing treatments. It is a kind of a wake-up call to the skin to regenerate and produce more collagen and elastin. It's great for deeply imprinted lines, severe photo damage, and for severely aged skin. The caveat is significant downtime. So the patient, unfortunately, does not look great after the treatment. There is a lot of redness, a lot of scabbing, and that goes on for a few days. and can be quite bothersome to many, many patients who cannot, for example, take time off work or have social commitments. It's quite difficult to deal with that. It is the level where they can't really leave the house and do their normal activities. So let's talk about the controversial treatments. So botulinum toxin and dermal filler. I'm sure that everyone has heard about them, and I'm sure everyone has seen some very, very bad dermal fillers and botulinum toxin. The reason why I say botulinum toxin and not Botox is because Botox is a trade name of a prescription drug, and botulinum toxin is the substance that is the active molecule in the prescription drug that we use. In my experience, treating patients with botulinum toxin and dermal filler can lead to amazing results and can really, really help them in the short term with severe signs of aging. And there is no risk of looking unnatural when these treatments are used correctly and safely by trained healthcare professionals. So what is botulinum toxin? Botulinum toxin is a natural toxin in the nature, quite a powerful one. It's produced by a bacteria called Clostridium botulinum, and it blocks the muscle contraction. So it inhibits acetylcholine, which is a neurotransmitter that takes the signal from the nerve to the muscle and tells it to contract. In the actual concentration that we use it for aesthetic treatments, it's not powerful enough to cause any poisoning effect, but if ingested in large doses, it could cause symptoms of botulism and even lead to death. So it's a very powerful toxin that we have in nature. So what does Botox do? It reduces wrinkles by relaxing the muscles. So through relaxing the muscles, it actually prevents us from imprinting those lines in the skin as we move. So as we frown and raise our eyebrows, it prevents us from doing that. And it naturally follows that the lines that are created when we dynamically move are not getting imprinted in the skin. It's a very safe and well-researched drug. It's widely used in many healthcare services for various reasons. We've had many randomized control trials with it, and we have a lot of clinical information on how it works, how long it works, and what is the safety profile and potential side effects. Generally very well tolerated. Side effects are mild. They range from little spots of bruising from injections to small risk of infection, as with any injection, to droops and drops when they affect the wrong muscle. Botox usually lasts between 3 to 6 months. The limitation is that it doesn't actually address any underlying skin aging problem. It does not improve skin quality, it does not address volume loss, and it is quite a temporary effect that it has. It can also be quite addictive, so some people can get addicted to botulinum toxin. We don't really know why, whether it's the cosmetic effect or the effect that it has on mood. So interestingly, there is a significant effect on mood for the psychologists there out among you. It is known to be an antidepressant. So there was a study published in one of the Nature journals, and it showed that actually Botox can help to reduce depression. The effect was observed regardless of where botulinum toxin was injected. So that proves that it is a chemical reaction that is causing that effect, rather than the cosmetic effect where we frown less, so we feel better as a result. Here is a twin study just to see the effects of botulinum toxin injections. So that study was published in the Archives of Plastic Surgery, and we can see a comparison of identical twins, one of whom received regular botulinum toxin injections for many, many years, and one didn't. And we can clearly see that twin A, who did not receive injections, has much more imprinted lines around her forehead and around her crow's feet. Now, these effects are fairly temporary. So, for example, if a patient has a break from botulinum toxin injections, let's say due to pregnancy and breastfeeding, these lines will come back, they will get imprinted again. But if we inject them with botulinum toxin again, when they can have the treatment, these lines disappear fairly quickly. So it is also easy to reverse that effect of having a break. Now, dermal fillers, I'm sure you've seen some very bad dermal fillers. If a dermal filler procedure has been done well, then it should not be noticeable to an untrained eye that anything was done. Now here you can see a patient who suffered from lipodystrophy. This is one of my patients, a lady who had side effects due to the medications that she was taking, and she suffered from extreme volume loss. You can see the depletion here in the fat pads. So this is related to what we talked about when we talked about skin structure and the hypodermis. We have that fat layer that is underneath the skin that supports the structures, and it is really important to the youthful appearance of the face. She had a few treatments, usually one month apart. I think in total she had around 7 milliliters of dermal filler. That was hyaluronic acid mixed with calcium hydroxyapatite. This lady is another patient of mine who also suffered from facial volume loss that was due to rapid weight loss. So you can see how rapid weight loss can affect the fat tissue in the face and cause an appearance of aging and hollowness. This effect is now quite popular due to the phenomenon called Ozempic face. So a lot of the patients who take Ozempic, which is a weight loss drug, and lose a lot of weight quite rapidly, develop that kind of a hollow appearance. And that can contribute to their appearance of aging as well. Dermal fillers, what are they? In short, they're a gel implant. So we can use hyaluronic acid, which is a natural substance occurring in our eyes, joints, and skin, which is highly purified and sterilized. And it's made into pre-packaged gel in a syringe, which we can inject to replace those facial fat pads that were lost. We also have calcium hydroxyapatite. So that substance has some biostimulatory properties. It can be mixed with hyaluronic acid, or it can be used alone as a filler. So in addition to the volume effect, it also boosts the production of collagen and elastin. And same for poly-L-lactic acid, which can be used as a biostimulant and is often used for body treatments, such as cellulite treatments, for example. In terms of the side effects, again, dermal fillers are fairly safe. They're fairly well researched. Unfortunately, there is not much regulation in the industry, at least in the UK, as to who can administer those injections. And in many cases, when they're administered by beauticians or people who do not have any medical training, things can go wrong. So we can see infections, abscesses, vascular occlusion, so a blockage in a blood vessel that creates a kind of a suffocating environment for the surrounding tissues. So that can lead to necrosis and the skin around the blockage dying and falling off. The results from dermal fillers are fairly temporary, so they usually last, we say, between 6 to 12 months, although on some MRI studies, we saw fillers lasting even after 15 years. So I think it really depends on the patient's metabolism, on the type and volume of product that was used. And also, we need some more studies in that area. I think that we don't really understand everything about how we metabolize those gel implants once they have been injected into the skin. So let's have a short critical analysis of dermal fillers and Botox as potential anti-aging treatments. They are often marketed as anti-aging treatments by clinics and by manufacturers. Are they truly? Well, I don't think so. I think they are very temporary treatments. They can certainly help with signs of aging, and they can have a marginal biostimulatory effect. So, for example, in the case of polyallactic acid, of calcium hydroxyapatite, but the long-term effects are really not there enough to say, yes, these are anti-aging treatments. There are also concerns about body dysmorphia, and we increasingly see young, impressionable patients who present wanting dermal fillers because they saw a certain type of appearance on social media. That can actually have an aging effect on their face. So as you can see here, this has been illustrated very well by a plastic surgeon from Philadelphia called Dr. Subio. This is the effect that dermal fillers can have on a young face. So that kind of overfilling of the cheekbones, of the jawline, of the lips can create an incredibly aging effect where a 20-something-year-old patient can look middle-aged. And then it's very difficult to say, is this patient actually a young person, or isn't it an older person who's just trying to look younger, and they had so many treatments that you can't even tell their age anymore, but not in a good way. So I think we need to be very, very careful about those treatments, how we talk about them, how we communicate, and what is being marketed out there, particularly to young people who have a little bit of an unstable body image, and they can be prone to dysmorphia. I've seen quite a few patients who unfortunately lose touch with reality a little bit. So they would present with a massive amount of dermal filler, hugely overfilled face. Not my patients, they come to the clinic to get more fillers. And unfortunately, I have to turn them away. It is quite difficult to tell them, look, you've completely lost touch with reality. This is not what a normal human face looks like. But unfortunately, this is very common. So we see it increasingly. And it's important for doctors to have the confidence and the knowledge to actually say, no, you need to stop. That is not good. It does not have a positive effect on your image. So let's talk a little bit about the emerging treatments that we have. Stem cell therapies are one of my favorite areas of research at the moment. There is a lot of things happening in this space. There is much more studying and research that has to be done in this area, but there have been some promising results with stem cells. So what are stem cells? Stem cells are special cells in our bodies. We all have them in embryonic and adult state. And they have the ability to develop into many different types of cells. So they have a great capability for healing. The types of stem cells, embryonic, the ones that come from the embryos, and then the adult stem cells, they are found in the bone marrow and in the fat cells. Fat actually has a much higher concentration of stem cells than bone marrow, so we usually harvest the stem cells from the fat rather than the bone marrow for clinical procedures. They're also gaining popularity when it comes to cosmetics. Usually cosmetics do not use any live stem cells. They use stem cell extracts from plants. The use of human stem cells in cosmetic products is prohibited in the US, in the UK, and in Europe. But there are some big claims being made with plant-derived stem cells. Whether it actually works, that we will have to see in further research studies. It's not very well proven to actually have an anti-aging effect on human skin yet. There is some marginal evidence that they improve hydration and they improve elastin and collagen production, but nothing robust yet. In terms of the procedures with stem cells, we can either microneedle stem cells in, or we can inject them into the areas of concern. So in a clinical environment, what we would do is harvest stem cells from the patient's fat, usually on the abdomen or the backside, and then we would process it in the clinic. So we would harvest the stem cells, purify them, and put them in a syringe and re-inject them into the area of concern, with the hope that it will provide a regenerative benefit to the patient's skin. Does it work? Anecdotally and clinically speaking, yes, there are improvements, but I think this area of medicine has to be much better studied. So it's a regenerative medicine where we need much more robust evidence about what these stem cells actually do. The reasons why it's fairly safe is because these are autologous stem cell transplants. So they come from the same patient and they are injected into another area in the body. So it's not like they're receiving some foreign material or, for example, embryonic stem cells that were harvested from somewhere else. They are receiving their own cells. So there's no chance of rejection, allergic reaction, and actually quite low chance of anything bad happening other than side effects related to injection in the short term. But in the long term, the truth is we don't know. We need more studies. Then we've got gene therapies. So as discussed previously, the genes have a very significant effect on aging. And we are slowly developing gene therapies that could potentially be useful in skin aging. Now, this is a sci-fi area of potential future directions. So we do not actually use gene editing on live organisms at the moment to improve skin health. However, we do have the technology to do it. So we have the CRISPR-Cas9, and the Cas9 is the enzyme that cuts the DNA very precisely and enables gene editing in humans, in live humans. There's also potential for other avenues there. So many more treatments to come. But the risks are fairly significant. So as you can probably imagine, there are lots of ethical implications of gene editing in humans. There's still not a single regulatory body that has actually approved gene therapy for skin aging. So this is very much a future area for exploration. Nanotechnology, I'm sure that you heard about nanoparticles in skincare. They are very heavily marketed at the moment. So that is the next big idea that is emerging in skincare. If you imagine a nanometer is 1/1000th of a meter. So it's impossible to see to a naked eye. It's around 5 atoms big. So nanotechnology is where we use those nanoparticles to make things and make them behave in particular ways. Sometimes we can train them to behave in particular ways. I would like you to note that on the nanoscale, the particles behave completely differently to the macro scale. So for example, if you take a piece of gold and you shrink it to the nano size, it will no longer be gold. It will be more something like a fluorescent red or purple. So the particles behave completely differently because of the quantum effect. Now that is very good because normal rules do not apply, which means that we can do a lot of things with the nanoparticles that are very exciting for skincare. Are we currently using nanotechnology in skincare? Yes, we are. Welcome to the future. So we have many different forms. The most popular one is micronized zinc oxide and titanium dioxide. So these particles are included in sunscreens. As we previously talked about, we've got the reflective particles that reflect the sun rays and protect your skin from the harmful effects of the UV rays. They're about 100 nanometers in size, so they form a kind of a sheer layer. Lots of sheer sunscreens at the moment use those nanoparticles to reflect sun rays, and they do not penetrate through the skin surface. They're fairly safe. They will not get deep into the skin, which is not true, for example, for things like buckyballs. Buckyballs are the carriers that are sometimes used in cosmetics in Asia. They're not currently used in the US or in Europe, and they're banned. They're very tiny. and there is a potential risk of their penetration to the blood, into the brain. So lots of health concerns. We don't really know what their impact on the environment is. So I think that caution is very much advised, as exciting as they might be as carriers for active substances that we want to deliver deep into the skin layers. So in conclusion, nanotechnology is already budding in skincare. It's a very promising future avenue. We are already using nanoparticles with some success in sunscreens. And at the moment, we will just need more research, more evidence, particularly on the long-term safety of those nano products. Then moving on to personalized treatment approaches, I think that the future of anti-aging medicine is personalized medicine. So that's where we take the patient's genes, their environment, and their lifestyle into consideration. These treatments are gaining in popularity, and there are more and more clinics opening worldwide that focus on anti-aging medicine and offer that kind of holistic, personalized approach. I use quite a lot of genetic testing in my practice, and I have to say, definitely more studies will be needed in this area to make sure that the findings are robust. But clinically, I'm seeing quite a lot of improvement with those patients who are guided by their genetic test results in their management. In conclusion, skin aging is a complex biological process which involves an interplay of intrinsic and extrinsic factors. The current treatments that we have can be very safe, very effective. I think that everyone today can take at least one treatment that they heard about that they can implement and use at home or in a specialized clinic. And we have some very, very exciting future directions as well. I think that what is very much needed in the field of skin anti-aging is the change of public perception. So looking after your skin is not superficial or vain. It is an important healthcare intervention. And I think that we really need to start applying the rigorous scientific approach that we use, for example, in drug discovery, to inventing and discovering treatments in skin anti-aging. Unfortunately, there are a lot of companies who are incentivized to make false marketing claims in this area of medicine, and they're releasing products that are half-baked and not really working, making those claims and then undermining the public trust in the whole skin anti-aging industry. So I think if we have the right investments, the right mindset, the right motivation, we can really make sure that we are using this robust scientific process applied to developing new skin aging treatments, and we can develop products and interventions that we're going to be proud of and that will also serve humanity's well-being in the long term. Thank you very much.
Perfect, Kat. Excellent. Started at 1+1 and ended up with the latest technique. So we've got about 30 minutes. So what we'll do, the protocol here is I'll pick out some questions from the chat, but if people want to use the raise hands function, that will prioritize you over the chat questions and you can just ask them. Let me just stop the recording and then go. All right, so let's see, while we're waiting for the hands up, let me ask my question first. Right, there's all these creams. There's a vitamin C cream and this peptide cream and this sunblock. Are some of them barriers to the other thing? Can you use them all at the same time?
Yes, and you should use them all at the same time, but they should be used correctly. So some products interact with other products. So it's not like you can use all of them at the same time and they will have no effect on each other. It's important to have a routine that has been prescribed by a medical professional who knows about skincare, and then they can be safely layered. So there are certain products that can be used together and certain products that we do not use together because they either cancel each other out or they actually are harmful in that combination.
Can you give us some guideline, or at least the harmful one? Tell us not to do what not to do.
So I would not mix strong exfoliants together. I have seen many, many patients who've broken their skin barrier because they went to the pharmacy and there are so many over-the-counter products there, and there are lots of acids. And unfortunately, these products are cheap, so they're very accessible, and they're very strong as well. So they come in concentrations that can be quite dangerous. So if a patient layers those acids on their skin and combines them, they will have an effect similar to a very strong chemical peel, but in a very uncontrolled environment. So they will not control for the actual concentration that they are using, and for the clinical, they will probably use it at home. So there is a risk of infection with a broken skin barrier. So these products can actually cause something like a burn when used incorrectly.
And then, so what if you use a vitamin C cream along with the hydrolyzed collagen? That's what I'm getting out from your talk.
Yeah,
That I mean, if I'm
yeah.
doing nothing, and then maybe some moisturizer, that
Uh-huh.
make me look better. But even if is that a reasonable thing to
That's
do?
a very reasonable thing. Yes. So what I would recommend, on average, let's assume an average patient who has healthy skin, has no acne, no rosacea, no inflammation, and just wants to improve their skin quality in terms of anti-aging. So I would advise to use a cleanser based on ceramides, so a gentle cleanser to improve that skin barrier and protect from pollutants in the morning. Then apply maybe a toner to exfoliate a little bit, then a vitamin C serum or a serum with antioxidants. Make sure that is a good quality one, so it's in a dark bottle and the vitamin C is definitely active. And then sunscreen as the last thing, broad spectrum sunscreen, factor 50. That's in the morning. And in the evening, I would cleanse twice, so maybe wipe first and then wash your face with something like a detoxifying cleanser if you live in a very polluted area. And then you can apply your retinol and then a moisturizer to replenish the skin barrier. And then you can sleep sound knowing that your skin is regenerating and you're doing the right thing for your anti-aging routine.
Yes, sounds like for men that's way too complicated. We'll do one of those. It's
Okay,
uh,
we can
uh,
negotiate.
yes. And then what and I'll just inject my one question before we go to hands up. Because there's the body image and all that for young people. I mean, young people
Mm.
by definition have young skin. But at what age should you be trying to do things and retinol or something like that? Is it presumably 20s not relevant?
Mm.
Is it 32? Is it 40, 50?
So, for example, retinols, they're a great treatment for acne. So we get a lot of young patients who are very familiar with retinols and have been using them for a long time for their acne. And as a bonus, they are getting the anti-aging effect. So what usually happens is once the acne has resolved and maybe they're in their 30s, we just say continue that retinol. Of course, not while you're pregnant or breastfeeding, but continue that for as long as you can. You're already used to it, you're already tolerating it. So that's a kind of a natural transition.
Right, and then Botox that you would not recommend that for a 19-year-old or
Definitely not. No, no.
right,
Um, Unless for it's for a very specific reason, like for example, facial palsies or asymmetries, and those can be corrected by deactivating certain muscles.
right. And then okay, great. Let me stop hogging the questions. Let's go jump. Eric, go ahead and unmute yourself.
Hey, thank you. So my question is about the RF-based treatments, like Thermage and InMode. I'm trying to figure out what the actual like physics that are happening there is, because to me, it seems like there's a denaturing of the proteins happening that's causing the collagen to shorten. And I'm concerned about like long-term side effects, especially like the fascial disruption where like, the skin, it seems like it's kind of being laminated, like the layers are
Mm.
being like, almost seated and glued together in a way that I have concerns about like lymph fluid being able to flow through and like disruptions to natural processes from this.
Of course, yes. Thank you, Eric. That's a very reasonable question. So some of those devices and treatments unfortunately use very strong radio frequency. And at that level, at a very strong level of radio frequency, it can actually be potentially dangerous, as you said. It can cause side effects. We don't really know exactly the full extent of what side effects it can cause in the long term because there are limited studies in that area. However, in most anti-aging treatments, the level of radiofrequency that we actually use during the treatment is quite low. So it doesn't cause significant tissue damage, if that makes sense.
Okay. Let's see, Mike, great to see you here today.
Yeah, thanks, Ron. So, yeah, one thing that would like some clarification on, you covered a lot of the general stuff, Kat, is so for example, crepey skin, I'm seeing like in the inner elbow, an area where there's a lot of flexibility in that skin. Interested to know, cause and potential corrections for that, and have another question after.
Thank you so much. So yes, the effect that you're observing is from a mechanical stretch. So skin in those active areas is actually quite traumatized because we use it so much. So it's the repetitive strain on the skin. And we often see this with patients who have eczema as well. So they have pronounced areas of inflammation around their elbows, where they're bending their elbows because it's such an active area. So that would be probably related to physical damage. Some genetic factors might play a part as well. And the way to treat it would be like any skin aging. So that would be using those collagen stimulating treatments like retinoids, like lasers, for example, if you're feeling more brave about it and more motivated. But yes, any treatments that improve the skin elasticity, act on the collagen and elastin production would be helpful in that case.
Okay. And the other question I had was related, had heard something recently that's supposed to be relatively effective for presbyopia, right, which is the lens flexibility problem that affects nearsightedness, is carnosine drops.
To
And, it's a topical thing,
patient
almost skin
is sort of like a
related.
young longevity seeker, no real.
Sorry, I don't know if you heard me.
Someone, your mic is on and you're on a call.
Did you hear me, Kat, when I was asking about the carnosine drops?
No, sorry, could you repeat that, please?
Oh, sorry. I had heard carnosine drops are useful for presbyopia because of the lens flexibility limitations that develop over as aging happens, and was wondering if carnosine drops are, another thing you've heard for other effects in, a topical for any other, aspects that
So
could be helpful.
personally, I have not heard about that approach in terms of topical, but I think that's probably a question for an ophthalmologist. I'm not familiar with that. My mom is an ophthalmologist, so perhaps she would be able to help. I can ask her that question and get back to you.
Okay, great. Let's see. Oh, there is a hands up. Who's Kristen? Go ahead.
Yes, I'm wondering if you could talk a little bit about sort of the rest of the skin. So we've talked kind of a lot about treatments for the face and the visible neck area, but we have a lot of other skin. Of course, sunscreen is important, but what should we be thinking about when we're trying to moisturize and take care of the rest of our skin?
Brilliant question. That is also a question that I often get asked by the patients because they say, Doctor, when I'm 90 years old, I will have that perfect looking face and then a sagging skin on my entire body. So the skin type that we have on the body is slightly different to what we have on the face. So it's much thicker skin. However, all the treatments that we talked about would also apply to the body. So for example, we use retinol creams for the body to stimulate collagen production. We use them to treat acne on the body or inflammation. We can use red light therapy. I don't know if you saw those blankets with red lights. They're quite cool. So red light therapy can also be used on the body. Radiofrequency microneedling is very often done for the body. It's a good treatment for stretch marks, and it's quite a popular one. That also has that long-term potential of stimulating collagen and elastin. If you're feeling more ambitious, then you can do lasers for the body, but that might be a little bit challenging with the cost benefits and also the downtime.
Okay, great. No hands up. So I'll ask a couple more questions that I'm interested in. Showering. Somebody asked that question about showering. If you don't shower every day, or you should shower every day, does that have any effect on our skin and face and the like?
That is a very good question. So whenever we take a hot shower, there is a small disruption in the skin barrier. So that brick wall that we talked about with the cement between it gets a little bit disrupted. And that's why we get so much dryness and potentially redness and itchiness after a hot shower. So if you like taking hot showers, I would advise to do that cautiously and bring the temperature down a little bit. Don't do that every day, and definitely moisturize after you've taken a very hot shower. The kind of lukewarm water showers, they are not as disruptive to the skin barrier. So I think a gentle temperature shower every day is completely fine, but I just would not overdo it on the heat, and definitely advise to use a moisturizer after you've showered to replenish that skin barrier.
And cold shower?
Yes, they're great. Yeah, I love cold showers. I love cold therapy. It has very good effects on mental and physical well-being. Allegedly, it has some anti-aging effect as well, when done, I think 2 to 3 times a week. So why not? And yes, definitely moisturize after a cold shower as well. And don't do that too often, because that will also have a potential of disrupting the barrier.
Okay, let's see. Nicole has got a question. Go ahead.
Thank you so much for a very informative presentation. I was wondering if you could tell me what you think about, you mentioned the microneedling. What do you think about therapy, CO2, lasers, plasma pens? What are your
So,
thoughts?
I personally do not use therapy. I know that it uses ultrasound waves, but I think there is quite limited evidence on what the ultrasound wave actually does. I have not seen any particularly amazing effects in clinical practice from therapy, but I do use a CO2 laser, and I can tell you that is the nuclear option in cosmetics and also in anti-aging skin treatments, because it ablates the top layer of the epidermis. So it completely takes it off, which means that the skin can regenerate, and it will regenerate very fast to replace that. And it is replaced with new healthy cells. There is also the upregulation of the collagen and elastin genes that we talked about. So let me find that slide.
And while you're just going through everything, what about threads? I know they're cosmetic, and everyone, it's like sometimes people say that they create collagen, other people say that they don't. It's just scar tissue.
There is certainly a lot of scar tissue involved. So threads are very aggressive, and I am personally not a fan of threads. I can see some very serious side effects out there in patients, and it is a very aggressive treatment. So effectively, what you are doing is you're putting a thread and you're forcefully stretching the skin, and that thread will stay there. So the skin will form scar tissue around it. There's also potential for infection, so abscesses can form around the thread that can be quite dangerous and might require surgery, which can be potentially disfiguring. And also, why use such an aggressive approach if we have much milder and less risky approaches to skin anti-aging?
I'll stop it just a second. I had asked about the plasma pens. What do you think about the plasma pen?
Plasma. There is not much evidence for plasma. Unfortunately, I have researched that a little bit. I was thinking of maybe getting a plasma device, but from the research that I have done, I am not convinced that it actually has a clinically significant effect.
Okay. And you're starting to see estrogen in facial creams for menopausal women. Is that, is that worthwhile?
So scientifically speaking, it's certainly worthwhile. I wouldn't say it's as worthwhile experimenting on yourself with the estrogen creams. It would have to be guided by a physician. So they would have to be prescribed by a doctor, and the management would have to be guided by someone who has clinical experience in that area. When I talked about HRT, so hormone replacement therapy, I said that it is still a very controversial thing with regards to skin aging. There are mixed results in clinical trials, so we do not actually know if it genuinely does have an effect, or the patients who are using it and see a great improvement maybe have it for other reasons, because things in biology and anti-aging can be complicated. So it could, for example, be other ingredients that are having that effect. So the answer is we don't really know. We'll probably find out in the next few years whether this is genuinely effective or not. But if you are willing to try and your doctor is willing to try, then I think it's fine to go ahead with that.
Great,
Okay,
thank you.
let's go to let's say Jason, go ahead.
Thank you. Very impressive talk. I had a question. In terms of like blackheads or like pores, is there a way to any like specific procedures that can like eliminate those? And do they work? Do they not work? I'm just curious about that.
Absolutely. So we do have procedures that are very effective at shrinking the pores, removing blackheads. So chemical peels are very good at that. So one way of getting rid of them would be to go to a clinic that specializes in skin and having a chemical peel regularly that is guided by your medical history and by the severity of the problem. And that should absolutely resolve with several treatments that are done properly. In terms of at-home products, sulfur is very helpful. So using sulfur masks, for example, that also contain clay, they're very good at targeting blackheads specifically.
Okay, yeah. So there is some gap came in from the maturity. Do you want to roll it over to 12 months?
Sorry, I couldn't hear you there.
That was a different question.
Yeah, I'm not
But
sure. Oh yeah, it was
it-
just oh yeah, I was just wondering, you said the size, but can you do also like the number of pores too, or is that a different concept?
So the number of your pores will not increase. That your skin has a particular number of pores in it, and it will not decrease. But the size
okay.
of the pores can definitely decrease with the right treatments. And this would usually involve some form of chemical exfoliation, like a chemical peel, or topical treatments, such as, for example, including sulfur, which is very effective at treating blackheads.
Thank you. Appreciate that.
okay,
No
no,
problem.
I've got a question. Lot, you go into well, here in the States it's Walgreens, or in Britain it's Boots, and there's hundreds of these things, or there's fancy places. Some of these things are cheap and some of these things are expensive. If you're paying more, do you actually get better ingredients? I mean, like for example, this is the SkinCeuticals thing. It's quite expensive and smells of fish for some reason. I'm not sure why. Maybe you can tell me why it smells of fish, but it's quite expensive. Do I need to get that, or can I just get Boots' own brand something or other?
So there is some correlation between the price tag and the quality of the product. So as we talked in the skincare, for example, peptides or antioxidants section, these things are difficult to formulate with. So they are very expensive to actually make properly, because these ingredients are very unstable. So they are sensitive to light, etc. So if you're getting a very cheap product, chances are that it's a little bit too good to be true, because it would cost them more to manufacture it than to sell it. So there has to be a certain price tag on those products. Now, I'm not saying it has to be the most expensive one. It just has to be the one that has been tested and has some clinical trials behind the formulation that they are using. So the products that actually work, for example, with vitamin C, unfortunately, do have a terrible smell. You say they smell of fish, I think they smell like hot dogs, but that is the smell of success in skincare. So it does have to smell bad in order to be effective. If they made a lot of additives and tried to change the smell, then it would probably affect the stability of the compound in question. So short answer, I would get a product that is well researched, well tested, that usually comes with a little bit more of a hefty price tag. But I wouldn't get the cheaper ones, the very cheap ones that are suspiciously cheap.
Okay, we've got all hands up popping up right at the end. Okay, Larry, go ahead.
Yeah, hi, Kat. Thank you so much for this wonderful presentation and all the time you
Thank
spent.
you.
I had to drop off for a few minutes, and so if you've already answered my question, just cut me off. My question is about wound care. I have a family member who has a wound in the coccyx area. It's a pressure wound. You know, the opening is receding. It's now about 2 centimeters by 1 centimeter, but there's undermining and a tunneling. What are some techniques to have the tunneling and the undermining heal? They're not progressing very fast.
So it is an active ulcer that we're talking about.
Yes, it is. Yeah, right now. Yeah.
So first of all, very sorry to hear about that. These ulcers can be very unpleasant for the patient. We do have interventions such as, for example, red light therapy, which are excellent at speeding up wound healing. So we're talking about speeding up tissue regeneration. That is what I talked about here. I don't know if you saw that or if you missed it.
I did see that, yeah.
So this is one great way of treating wounds that are difficult to heal and speeding up the healing process, because we know that it works. So we have randomized control trial to prove that it does. And also it is quite cheap and has pretty much no side effects and can be done at home with the right device. So red light therapy would definitely be my preference with recommendation for your relative. And also you could consider platelet-rich plasma. Platelet-rich plasma works on a similar principle that stem cells do. So we take a blood sample from a patient, spin it in a centrifuge, and isolate the serum, which is rich in platelets, growth factors, and that is the natural for that patient. And that has been proven to be quite effective in healing difficult wounds, particularly ulcers.
What did you call it? Platelet?
PRP, platelet-rich plasma.
PRP, yeah, okay.
Yes. The caveat with that is that these treatments are a bit like pizza. They can be very, very good or very, very bad. So it has to be done properly. So the sample has to be taken properly without hemolyzing the blood. And then there has to be a good centrifuge that actually does the isolation and the extraction process in a proper way.
Fabulous, yeah.
Right, let's go to Christine if we can get a couple of
Those would
questions.
those would treat the undermining and the tunneling.
So I would suggest these two treatments specifically for wound regeneration. I don't know about their effect on tunneling specifically. That is something I would have to read a little bit more about. But I can get back to you on that if you want to.
Thank you very much.
Great, Christine, go ahead.
Well, thank you for the presentation. I was wondering if it would be possible to receive a recording of this webinar.
Yes, yes, we will. Yeah, it'll be posted on our website.
Okay, perfect.
Thank you.
Okay, Ki-Yoon.
Okay, thank you. I have a question about the galvanic devices. I'm using the home galvanic devices, which will help the absorption rate of our skincare product. I'm curious about the effectiveness of the devices and other side effects as well. Thank you.
And could you tell me a little bit more about those devices? I couldn't hear you very well. What are they called?
Galvani, which helps the absorption rate of the skincare product with the differences of voltage level, as I know.
Oh, I see. Okay. Yes. So I don't know about that specific device that you have, but the principle that you're talking about is, I believe, sonophoresis, where we open the skin barrier in order to deliver the product, and we use that using a voltage difference. So I think that it really depends on the type of the device that you have, because some of those devices are quite well studied. So you can see devices that use an ultrasound or use an electric charge that opens the skin barrier and enhances the penetration of active ingredients. And that is a well-documented phenomenon, but the question is whether this particular device actually does what it says on the tin. So I don't know about that. I would have to check the specifications. But yes, the phenomenon is very real, that the one that you're talking about. So in principle, it should work at delivering the skincare ingredients. And then there is, of course, the question of what are you actually trying to deliver? So the ingredient that you're trying to deliver has to be safe and effective. So it has to be a good quality, evidence-based ingredient that we put in the skin. And then, yes, it should work in principle.
Thank you. Actually, many Koreans are already using that devices at their home, so I'm curious about the effectiveness of them.
Oh, I
Thank
see. Well, you can email us with the name of the device, and I'll see if I can read a little bit more about it.
Oh, thank you. Thank you so much.
No problem.
Okay, Kat. So we're just sort of wrapping up. So two kind of questions. One is, is there anything you're making that we can use? It sounds like everything, this combination cream. And second, what do you do yourself?
Right. So very excitingly, yes, there is something that I am making. It's still a secret, so it's still in process of being designed. But I am planning to release my own evidence-based skincare line. And these products will hopefully be available soon, and I will be able to talk about them a little bit more, not being bound by various NDAs. In terms of what I use myself, I use a topical retinoid, my favorite. Every night I use adapalene. I do not use a vitamin C serum. Sad to report, I have a very sensitive skin, which is prone to rosacea and inflammation. And as much as I tried, I cannot tolerate most vitamin C serums. I use a good moisturizer that is based on lipids, ceramides, and cholesterol. And that is the composition of the cement that binds our skin cells together. So it's the composition of that brick wall that has to be replenished in order to keep the pathogens out of our skin. I also double cleanse with a very gentle cleanser with ceramides. Sometimes use a detoxifying mask if I've been in an urban area, or for example, I use the London Tube, which is horrifically polluted, and a lot of dirt comes out of the skin after that. And I use radiofrequency microneedling periodically, as well as chemical peels, gentle ones, just to replenish that collagen and elastin in the skin. I cannot use aggressive treatments myself because of my skin sensitivity. But red light, for example, is one of my favorites. I regularly use it, and I meditate when I do it because that is the only way I can get any meditation in during the day. Otherwise, I get a lot of distractions from my patients, my assistant, and my dog.
And the red light, is that every day or once a week or something?
I try to do it 3 times a week, but I am quite busy. So hand on heart, I have not been using it regularly 3 times a week as I should have been maybe 2 times a week, most weeks, or once. Still, I can see some observable benefits. My skin is much less sensitized, and I think it's looking okay. So hopefully there is something I'm doing right there.
And then you have your own clinic. People, if they're in Britain, they can visit you and stuff, right? Is
Yes,
that right?
if you
Okay.
are in the UK, you're welcome to come to Cambridge and visit me and see my clinic and my dog Whiskey, who has been snoring here while I was presenting. You are very welcome to visit. And if you're abroad, we also sometimes do online consultations. So you're welcome to book yourself in.
Right, and then you can type your email address, and we'll send your if you'd like us to everybody, that so they can contact you.
No problem.
But it's so much so grateful for you to spend your time, because it's like 2 hours. It's very valuable time, and hit it right on the nail. And then we start at 1+1 for people like me who do nothing, literally nothing. And maybe I'll try and do something now to encourage me, because you know, I'm quite fit. I've got have a good running time, but I still look old. That's my problem. Though I posted the aging AI aging system, but hopefully we'll keep in touch. This lecture will be posted on the R42 website and also on YouTube, the R42 group channel, and we will be having another one of these in probably about 6-7 weeks time. And again, probably the next opportunity is 2 talks. Next week we will have Kristen Smith talking about patents. It's more of a business talk rather than a aging talk. And then August 16th, we'll have the fellows reporting. There are a few aging projects. There's an aging vaccine. There's a female aging project, amongst other things. So we will send everyone, by definition, if you're on this, you're now on the mailing list. Thank you very much. And thank you, Kat, for telling us in a very graceful manner everything you're doing. And why don't you type your email address in the chat just before you go? But
Yeah.
we'll send it out anyway.
Doing that now. And thank you so much, Ranjan, for inviting me and for this opportunity to share my thoughts with everyone. I hope that was helpful and informative. And yeah, hope to do many more talks like that in the future.
Perfect. Right, there we go. Inquiries up. There we go. In the UK. There we go. It's all right. Thank you very much. Bye. Maybe we'll see you next week on patents.
Bye-bye. See you.
Bye. Bye.